Hi, Jen. I appreciate you sitting down with me today to have this discussion. I know it's one that you and I have had before, but I think it might be really helpful to share with the entire rare disease community. Obviously, not all people with rare diseases are going to require ABA therapy, but I know from experience that it's a pretty structured therapy. And my daughter, Kenzie, has a very rare condition, so you've had to sort of adapt and shape that therapy to fit her effectively. Sometimes other common routine therapies, not just ABA, PT, OT, speech, all have to be modified to meet the needs of children with uncommon challenges. To a certain extent, therapy always has to be fitted to a child, but in cases of kids with rare conditions, challenges can be novel and unfamiliar to their therapists. Could you share a little bit about how the rarity, first of all, introduce yourself, tell us a little bit about you, and then go into how the rarity of Kenzie's condition has affected her ABA therapy or how you've had to shape her therapy.
So my name is Jen Sweats. I have been a behavior analyst for, since 2016. And I just want to say first, thanks for inviting me to participate in this, because I do think advancing the awareness of rare disease is really important. Most people take their health for granted. And when you're challenged by a disease that's rare, treatment specialists are limited. Even getting a diagnosis can be a long process,
Absolutely.
expensive,
Yeah.
and really difficult. Due to the rarity of a condition and the unique comorbidity of conditions that are occurring together, treatments are often like trial and error or off script, because there's just limited research. So I'm excited to be able to share some of my thoughts on the subject as they relate to my field, applied behavior analysis, which ABA is applied behavior analysis. And it's all about behavior. So anything an organism does. And the field of ABA focuses on changes in the environment. So we're looking to adapt behavior so that it's the most functional that it can be for a certain individual. And just really quick, I want to talk about there's 7 dimensions in ABA. And I think this is important to touch on. So really quick, generality, which means it can be seen across environments or into the future. It's effective, meaning it's working, it's successful. It's technological, so the changes being made are clear and concise, and they can be replicated by others. It's applied, this one's my favorite. So the changes are socially significant. You're always prioritizing to the learner in the setting what is important to them. Conceptually systematic, meaning that it's aligned with and based in research. Analytical, so you're using data on the behavior to decide if it's working or not. You're not just saying, oh, I think it's working. You're actually using data to reflect that. And then it's behavioral. So what is being selected to change is both measurable and observable. So I think you hit the nail on the head. Every person is unique, right?
Some more than others.
Yeah, right. Some more than others. So I think when you say that all therapies and treatments have to be adapted to fit the individual, that's definitely true. However, when you have a person that has a rare diagnosis, the likelihood decreases of a practitioner having experience with or research having been done on that specific condition. I see this impacting how I analyze behavior, especially in Kenzie's case in a few ways. Most importantly, I think I find that knowing and understanding both the individual and those who share time and space with that person is exceptionally critical. In order to stay true to the applied dimension of ABA, you have to listen to what this person's needs are. Using curricular assessments to generate programming. Curricular assessments are great. They tell us how kids are functioning compared to typically developing kids their age, but in rare disease situations, it's just seriously insufficient to do that. You have to get really creative. So I find myself placing a lot of emphasis on the generality dimension also. So what will this person's life look like in the future? What environments are they currently in? How does this impact what skills we're targeting on? Is this a stepping stone for another skill that they need to have? So sometimes a disease is so rare that these questions come up and they can't be answered and you just have to try different things. And I think one of the things that we've been talking about even just today during our therapy session is this difficulty of being able to tease out if it's something medical or if it's something behavioral. Are we dealing with something related to the rare disease, or are we dealing with like a behavioral issue? And I think it's really important for analysts to listen to the providers, the care providers in those situations, and be able to adapt accordingly.
So as a BCBA or Board Certified Behavior Analyst, have you had to reconfigure or restructure your approach to therapy with working with Kenzie, but also finding a technician who can work her case that maybe likely doesn't have any experience with a kid even remotely similar to the challenges that Kenzie has?
Right. So for those with limited experience with ABA, I just want to quickly explain the structure of the therapy. So a behavior technician works directly with clients and they're implementing programs of behavior increase or decrease, and they're collecting data on those behaviors. So a technician's role is heavy in the technological and behavioral dimensions. They follow clearly written protocols and then they observe and measure the behavior. And behavior analyst, or BCBA, which is my position, has a caseload of clients that she oversees by writing programs, analyzing data, and then making adjustments to treatment. This is heavy in the effective and analytical dimensions of the field. So you got to make sure that something is working and you're using data to make those decisions. So the best thing about a good fit between a behavior technician and a client is the effectiveness of the treatment. I look forward to working with technicians who are interested in learning, but also interested in sharing what they know and observe. Supervision as an analyst is provided at roughly 10 to 20% of the hours that this client is in therapy. So 100% of the hours they're in therapy, they're with this technician. So it's really important that they have good interpersonal skills because communication is necessary. With the client, with the family, and with the analyst. So when you put a rare disease in the mix, there's another layer of comfort that you have to seek out in a technician. They have to be okay with really not having all the answers and trying new things or doing things in a different way, and then listening to feedback from both the family and the analyst on what's going well and what isn't going well.
You've been down this road with me more than once. And it's not necessarily that the therapy provider is doing anything wrong or that the technician is doing anything wrong. It's just that sometimes the needs of your individual child are so unique that the pool of qualified or specialized individuals shrinks. It gets quite small. Sometimes that can be quite an isolating and hopeless feeling for a family like mine that has a kiddo that nobody really has any experience with. You've had to tell me before that Kenzie has a good team of professionals, and to try to stop feeling like the weight of the world is squarely on my shoulders. And I can't tell you, in that moment, I was weeping as I was reading it because it was exactly what I needed to hear. Like, it's not just me advocating for Kenzie. And even though sometimes things aren't working or we have to reshift or reevaluate what we're doing, there are people that care, and they may not be specialists, but we're all on the same team. We're all collaborating toward the same goal. And I think that's really important for families to know and to hear every once in a while, that we're all on the same team here and we're going to get there, even if there's a bump here and there. What other encouragement could you give to a family who feels like that feels like they may never find the right fit for their child?
So I think one of the best and the worst things about working with an individual with a rare condition is that everyone working with this individual is in the same boat as you. Whether you're collaborating with a speech language pathologist or a neurologist or a a physical therapist. I mean, all of these specialties, chances are they're in new territory in their respective fields as well. So I've learned really to rely on other professionals, both inside and outside of my field, to inform my treatment plans, because you have to work together as a whole picture in order to get creative enough to help that individual. I say it's the worst thing, because sometimes when you want an answer, there simply isn't one.
Yeah.
Right. It can be hard and frustrating to constantly feel like you're in over your head. And I think professionals really identify with how parents feel when they say that they feel like that, like the world is on their shoulders. I'm supposed to be the specialist in behavior analysis, right? And I don't have a solution for this behavior problem. But just knowing that it's not all on my shoulders, and it's not all on the mom's shoulders, and it's not all on dad's shoulders, that we're sharing this work together and really working to support that person as a team. I also believe that most people are trying to do the right thing, so the best way that they know how. And I think that goes for professionals too. So just keep believing that everyone's doing the best that they can with the information that they have, and they want to do the right thing to help your kid.
So lastly, I just want to ask you if you could share one thing that you've learned from working with a rare kiddo with another provider, what would it be?
The most important thing an analyst can do is listen to the client and those that interact most with the client. You have to find out what matters and develop goals from that, because if you don't find out what matters, then what you're doing doesn't matter. So you really have to get to know the family and the client, and take the time to ask hard questions like, what's the toughest time of day? What's the hardest activity? What do you find, like, what if it was different would make your life better, the most improved? You just have to be creative and stay grounded in the principles of your science, but use those principles to do new and different programming.
Awesome. Well, I really appreciate you sitting down and talking with us today and sharing all of this about ABA. I think that a lot of people are unfamiliar with what ABA really does, but also our theme this year for Rare Disease Day is rare collaborations. So I thought that it really fit in nicely with that, because we're talking about how important it is to share. Maybe this is a very specific field, but we're collaborating with other fields, and it really doesn't work well unless everybody is collaborating or working together.
Yeah, we have those weekly sessions with other specialists in Kenzie's world, and I think that those are paramount to making her treatment the best, most effective it can be.
I agree, and I think that a lot of families maybe don't do it that way. So I thought that it was important to share how helpful that's been for Kenzie's case, to be able for everybody to be on the same page and share what's working, what's not working, ideas. I think our brainstorming all together is some of the best, most wonderful meetings that we've ever had.
Yeah, it's phenomenal.
And a lot of good work comes from that.
Yeah.
So, all right, Jen, well, thank you for sharing with us for
thanks
Rare
for
Disease
having
Day.
me.